Welcome to Mastering and Guideline in Ultrasound and Echo. Hi everyone. I'm sure every day or every other day at least you face with very hard cases. Those cases that has only uh, the best view. We have apical window like this. You can see every day almost, especially if you work in the hospital setting in the ICU. Patient is on ventilator or post-op or has severe COPD, and we don't have plaques window and not subcostal too. So we get it this apical. That is the best imaging. We have best view for apical. We can evaluate LV function, aorta, Doppler, mitral valve, but not the other. How we can get the evaluation for the tricuspid valve, for pulmonary valve, even for aorta. For example, sometimes you say patient they want to make sure aortic valve has bicuspid or no, normal. Anyway, how we approach in these cases if we don't have access and we don't want to do TE, how we can evaluate all information necessary for the echo on such patients. I am sure many of you forgot those views that we can use, and they are usually we don't use is not in the classic protocol, but as a ecotech you should be familiar, and believe me, those views and those maneuver save you and make you happy if you know how you use them, and especially in those situations. Now let's go see how we can approach to this type of the patient.